Hello, my name is Christine Deal, and I'm one of the instructors for this course, NU440. And I put together a presentation to help introduce students to the field of public health so they can gain a better understanding of the niche of public health in the healthcare services world and to gain a better understanding of past and future outcomes directly related to the public health services. So want to start with an introductory slide because some of you know me, but many of you don't. I grew up in Macon, Georgia, but I have since lived in Colorado, Florida, Montana, and I've been in Idaho for 20 years. I do come from a medical-oriented family. I'm married with 2 teenage daughters. My first degree was in anthropology. I got that from Colorado State University in 1990, and I was briefly in a master's program for medical anthropology, and it was in that process that I decided to become a nurse, and so I got my BSN in 1996 from Montana State University. I got my master's in nursing education in 2009 from Idaho State University. My background includes home health, med-surg, oncology, long-term care, psychiatric nursing, public health, which included school health nursing, and nursing education. I've been in nursing education for the last 13 years. And my favorite part of nursing is the education and empowerment that it provides for people to lead more healthy, safe, and productive lives. And that's both in the academic setting as well as in the informal education setting with patients. So learning objectives for this introductory PowerPoint is that by the end of this session, the learner will be able to first define public health, identify its 3 core functions, identify the principles of public health nursing, identify the public health sector and the role of the stakeholders, develop an awareness of a public health approach to decrease morbidity and mortality in a population, and identify the relevance of the public health perspective to an acute care setting. And I think that's really important because most nurses are not in public health. And when you think of that large number of nurses out there, only a small percentage are in community care settings. But that's becoming more prevalent, though. There's more nurses in community health because that's where the field of nursing, a lot of patient care is going and has been going. But even if you're in the acute care setting, you certainly can use a public health perspective in that setting. And so we'll hopefully you'll understand the relevance of knowing that perspective to any setting in nursing that you are in. So what is public health? So the specific definition of public health is dynamic and has evolved over time and across institutions. And 2 of the main institutions in the field of public health are the CDC, the Centers for Disease Control, and the Institute of Medicine. The CDC defines public health as the science of protecting and improving the health of people and their communities, which involves epidemiology, health promotion, education, wellness services, and screening. The CDC was founded in 1946. It developed from the wartime effort concerned with malaria control. The World Health Organization is another main player, and that was founded in 1948. Its goal, too, was the eradication of malaria at that time. Okay, so the Institute of Medicine, they define public health as what society does collectively to assure the conditions for people to be healthy. It is an ecological model that is used because health is influenced at several levels: social systems, environment, communities, and families. The science of public health has contributed greatly to the nation's health over the last 100 years. One of the most notable contributions to public health and decreased morbidity and mortality is the advent of vaccines to prevent diseases such as influenza, measles, and polio. So you see the bottom right, the picture of the man in the iron lung. That nurse is holding up a newspaper that is proclaiming that, or with the news that the polio vaccine is out, and it became licensed and approved in 1955. Major breakthrough. So the principles of public health nursing: first of all, the population is the client. The main obligation is the greatest good for the greatest amount of people. Public health nurses work with the client as an equal partner. Primary prevention is the priority. The public health nursing focus on strategies that create a healthy population. They actively identify and reach out to all who may benefit from a service. And use of resources must assure the overall improvement in population health. They collaborate with a variety of professions and organizations as the most effective way to promote and protect health. Okay, so 3 core functions of public health include assessment, policy development, and assurance. So assessment, okay, it's the first step in the nursing process. So assessment of a community's strengths and weaknesses, guide program development and implementation. So that would include things like, well, what's the water quality like? Helmet laws. I mean, are people practicing safe behaviors from what you see out there in the community? Are there safe areas for children to play in? And so some of this, you're going to identify this when you do your windshield survey for your community assessment project. And from the data that is gathered from the assessment, then policy development occurs. Okay, and then from the policy development, then assurance, because now we need to provide services to help achieve those health goals, those agreed upon health goals for the community based on the data that was gathered. Okay. So who makes up the public health sector? The government plays a key role in ensuring services are in place to protect the public and provide a healthy environment. These are at the federal, state, and county level, and also local stakeholders at the county level. Some federal examples would include the World Health Organization, as I mentioned, the Centers for Disease Control, and the Environmental Protection Agency. And here are hyperlinks if you click on these. I posted the PowerPoint as well. If you click on them, it will take you right to those sites. Some state examples would include the district health offices and the Department of Health and Welfare. And it is a community effort that involves public, private, non-government organizations and volunteers. Some examples would be the Transportation Department, housing authorities, schools, city planning, law enforcement, state wildlife agencies, media, academia, businesses, and community volunteer groups. So the stakeholders are people with a vested or legal interest in the solution to an identified problem. So take, for example, city planning personnel. It can include sidewalks, making sidewalks safe, bike paths to promote and support safe ways to exercise. School involvement includes health promotion messages, healthy food options. Academia certainly educates and trains the public workforce. The media is a way to reach a large amount of people. Again, the goal is the greatest good for the greatest number, so the media is also a way to educate large numbers of people. So employers and businesses contribute to the public's health by providing health insurance, for example. Workplaces also have wellness initiatives like a gym. Okay, so those are all examples of that community multi-effort. And here's a link to a website, to an article actually, that is really good because it gives examples of the private partners of public health, public-private alliances for public good. So there are 3 stories in here, or 3 cases about how all these are working together for community health. So the first case talks about chronic disease prevention services from employers to employees. The second case addresses unemployment as an underlying determinant of health. And the third case is improvement of worker safety through the use of trained peer health promoters in a migrant population in citrus workers in Florida. And so that there is a very good article, and it helps to really identify how it really takes a bunch of people coming together for the good of the public health, or the health of the community. Okay, so what determines the health of a population? This is a pie chart that I got from the CDC. So it's interesting to note that really the large portion is the social societal characteristics, the total ecology. Okay, so that would be the culture of the area. So societal and cultural norms have the largest impact, about 75%. Social and cultural norms, for example, influence food choices and physical activity, which of course plays a big role in health. Environmental characteristics such as lack of healthy food, open space for exercise and safety. So all of that is the large determination of health of a population. The medical care only accounts for about 25% of the determination of health in a population. And this is just an estimate of the four major determinants that influence health at the population level, okay, that I got from the CDC. The small blue section, those are the genes and biology. That's a lesser determinant of population health. So a public health approach, epidemiology. Epidemiology is the identification and investigation of risk to a population. It involves identifying populations at risk, determining the cause of an outbreak, and assessing the effectiveness of interventions done to improve the health of a community or population. And surveillance is the ongoing systematic collection, analysis, and interpretation of health-related data essential to planning, implementation, and evaluation of public health practice. It's closely integrated with the timely dissemination of these data to those responsible for prevention and control. Okay, and just to define these terms here, according to the CDC, an outbreak is the occurrence of more cases of disease than would normally be expected in a specific place or group of people, such as food poisoning or the seasonal flu. Pandemic is an epidemic that is widespread and often global, affecting a very large number of people, like the 1918 swine flu. Okay, cluster refers to a group of cases in a specific time and place that may or may not be greater than normal. Okay, investigation of disease clusters are used to determine the normal or expected rate of a specific disease. Okay, and when something is endemic, that's a disease or condition that maintains in an elevated but steady state within a population. It doesn't die out or change considerably. And again, surveillance is the collection of data which is ongoing, and that purpose for that is to provide information that can be used for health action by the public health personnel, government leaders, and the public to guide that health policy and programs for the health of the community to improve that. Okay, so public health approach epidemiology, historical background on that. John Snow is considered the father of modern epidemiology. So he discovered the case of cholera outbreak, he discovered the cause and cases, but he discovered the cause of the cholera outbreak in London in 1854. Cholera was thought to have come from bad air, but Dr. Snow did research and discovered a cluster of cases in one particular area that revolved around the water pump. So he sought out what these people had in common. And so watch his story. It's on YouTube. I've got the link here, and you can click it on the PowerPoint that I posted in addition to this recording. It's a really great visual of that identification and how he discovered that that was what was making people sick. Again, he's considered the father of modern epidemiology. Sorry about that. Okay, so public health perspective. Will I ever use this unless I'm employed there? Absolutely yes. Because although 60% of the nursing workforce works in acute care, the public health perspective is crucial in this setting. So here, patterns and trends are identified. The basis is in epidemiology, but can also gather data on the number of motor vehicle crashes, etc., that come into the ER, for example. The acute care sector is responsible to report certain communicable diseases such as Salmonella, TB, Shigella, West Nile virus, and HIV, as well cluster data identify unusually high incidences to the State Department of Health and Welfare, who then notify the local public health departments for tracking and follow-up. I remember when I worked in public health, we'd get calls all the time from people who were in the hospital, and they would have to report it. They would report it to the nurse epidemiologist at the health department, and then depending on what it was or what area it was, what county. I was involved in anywhere in Jerome and Lincoln counties, and we would go out and we would follow up with these individuals. So they were all required to be reported, okay? And policies are in place in acute settings to protect health and prevent illness. So that certainly is also a public health perspective. Okay, so some policies that are in place in acute settings to protect health and prevent illness include the use of universal precautions to protect healthcare population and patient population, required vaccination for all healthcare workers, negative pressure rooms for TB patients and TB suspected patients, protects the population within the hospital, prevention of secondary illness with coughing and deep breathing, okay, for patients, prophylaxis, prevention of peptic ulcers in a stressful acute state, prevention of pressure sores, e.g. the Braden scale to determine risk, oral care to the ventilated patient to prevent ventilator-associated pneumonia, and of course, education. All these are prevention pieces. All of these have the goal of improving patient outcomes and decreasing morbidity and mortality. And the Affordable Care Act now requires nonprofit hospitals to conduct community health assessments. So this perspective is very important and is very useful no matter what area of nursing you go into. In addition, hospitals strive to meet criteria for accreditation and excellence, and so in order to improve patient care outcomes, the staff nurse must apply public health science to improve the care they provide to their patients. Sorry, I keep doing that. Okay, so I'm going to leave you with an epidemiology video. Below is a link to a forensic file medical investigation program and the discovery of the cause of what was killing Native Americans in the Four Corners area in 1993 to 1994. I remember when this scare was occurring and nobody knew what was causing so many deaths in young Native Americans. So before it was identified as a strain of hantavirus, it was referred to as the Navajo disease. And so the article and video reinforces concepts that were taught in this introductory session here. So the article from the CDC, you can click on that link on the PowerPoint and read it. And then this forensic file is about it's on YouTube, is about 22 minutes long, and it is really interesting in how they went about the investigation, how they spoke with community members, the elders, asking, has this ever happened before? And they were very instrumental in putting that puzzle piece together to identify that it was from the mice that came about because there were more mice because there was more rain. More rain meant more growth, which meant more food, which meant more mice, which then meant a concentrated area, which then meant disease. So that is a really good example of an epidemiological investigation. I hope you've enjoyed this. I hope this gets you excited about community health, and I look forward to the rest of the semester. Thank you.